Put a finger down if you're about to do your first IUI cycle and you tell the nurse practitioner that you think you have BV, and she says okay, but still does the cycle anyway. And about 3 or 4 days later, you end up having excruciating abdominal pain and you can't stand up straight. So they send you to the ER, and it turns out you have pelvic inflammatory disease. So they keep you in the hospital for about a week on antibiotics, but once they send you home on oral antibiotics, it doesn't work anymore. So they admit you again and say we have to remove your ovary and fallopian tube because there's so much infection from the pelvic inflammatory disease. And you're in the hospital for another week, and they're trying to get a hold of the surgeon but can't get a hold of him. So he finally comes in, and he's really sketchy and cocky, and you have a really bad feeling about him, but you have the surgery anyway. And you wake up from surgery and you're super dizzy and you're throwing up bile, and nobody's believing the pain that you're in. So they send you home a couple days later, and you go 3 weeks still in excruciating pain and getting weaker and weaker by the day. And you call for more pain meds, and they say that you only had a lap and you shouldn't be in pain anymore. So you demand that you have a CT scan done. And when they do the CT, they say, oh, you have something leaking into your body. So they run more tests after they admit you, and it turns out you have, they perforated your bowel during surgery, and you had feces leaking into your body for 3 weeks, and you were going septic. And so they place a drain in your abdomen to get rid of the feces, and you have that for about 3 months, and then they remove 11 inches of your colon.